Okay. My name is Karl Blum. I'm an orthopedist. My office is in Toms River, New Jersey. I'm affiliated with Ocean Medical Center. I did orthopedic training in New York at State University in New York, and I did subspecialty training in sports-related injuries in Cincinnati. I spend about probably 60 or 70% of my practice on sports-related injuries, and people would say, oh, well, I'm not a pro player, I don't play in college or high school. But to be quite frank, that's probably only a small percentage of our actual patients that have sports-related injuries. It's mostly people going to the gym, weekend warriors, people that are playing games. And when we talk about sports-related injuries, we normally are talking about either acute injuries where you twist your knee and you injure your knee or your shoulder, dislocated shoulder, ankle injuries, or sometimes they are sports-specific where you might have something that's very like an overuse injury with a pitcher or a thrower, elbows or shoulders. So they're usually either acute injuries or repetitive type injuries. In general, our practice is made up of some percentage of elite athletes, but most of the patients are people like me that go to the gym and like to play on weekends. The most common injuries in all of sports would be ankle sprains, which would be #1 across sports, especially turning, twisting, cutting sports, but even people that jog, they can roll their ankle. Knee ligament injuries are very common. The most common is a medial collateral ligament injury. And then each sport seems to have particular injuries that are more common with their sport. Baseball players tend to have repetitive injuries with shoulders and elbow injuries. Sprinters, people that have explosive sports, they tend to get a lot of strains of muscles, things like that. Gymnastics, very common injuries in their elbows because each sport tends to load their joints in different ways and they tend to do repetitive things too. In general, if I have an athlete that has an ACL injury, that usually requires surgery. Almost always, if someone wants to play ball, if they're in high school and college, they're probably not going to be able to play most sports and have an ACL injury. In addition to that, people without ACLs tend to destroy their knees over long periods of time. So even if you're 17 and you say, Doc, I don't play sports, it's still a consideration to reconstruct that, even if you don't want to play aggressive sports. The other thing of interest is that females tear their ACLs at about 4 to 6 times more than guys do. If I have somebody that has a twisting injury to the knee and within about 6 hours, their knee blows up very big, and if they tell me that they felt a pop, there was a statistical analysis of those 3 things, feel a pop, big swollen knee after a twisting injury playing sports, about 70% of those patients are going to have an ACL tear.